one of the things I just wanted to give you an example of is the question of why reviewers feel the need to analyze clinical trial data. Sponsors have gone to great lengths to analyze their clinical trial data and present it with all sorts of analyses. So oftentimes people outside the FDA wonder, well, why do you feel the need to reanalyze it? And so I wanted to show you one example, and this is just one example, but experienced reviewers have countless of these examples. And it's not to say this is happening all the time, but it happens enough that reviewers feel the need to actually perform their own clinical trial data analysis to validate and confirm what the sponsor was seeing. So this is a review that I did when I was in anti-infectives, and I was reading the sponsor study report, and the sponsor was almost bragging about how their drug was so easy on the liver and even almost protective. And so that sort of set off a little alarm in my mind, and I thought, well, that sounds a little strange. Why don't I go do my own analysis? So before I show you what the final label looked like, let's take a look at what the sponsor's proposed label was. So they have 2.5 versus the comparator, which is 4.1. And again, this is a table that appeared in their proposed labeling. So let's take a look and see what the final labeling, the approved labeling, looked like. So it went from 2.5 to 5.6. So not only is it not less than the comparator, it's actually more than double and now higher than the comparator. Well, this is essentially what happened. The sponsor in their analysis decided to restrict the window of analysis to include only events occurring within 5 days of the last dose. Is that an appropriate thing to do for this drug? Well, it turns out this drug has a pretty long half-life, and the drug was on board for up to 9 days after the last dose. So when I expanded the window of analysis to include data that was in a more appropriate window, I found a whole lot of adverse events with liver enzyme abnormalities that weren't included in the sponsor's analysis. And part of the reason why this was confusing to me is I had no idea they had done this. There was no sort of description of it. There was no explanation. And so even what looks like essentially a simple analysis, depending on your approach, you can really have a pretty significant impact on the results. So even for simple analyses, reviewers feel the need to perform analysis, especially if they feel it's an important analysis that informs the safety and efficacy of the product. So now let's go back, let's shift gears here and talk about sort of the history of drug review in CEDAR. When I joined FDA in the year 2000, I got my first review, and I was excited and I was ready to go, and I went up to my team leader and said, okay, what do I do now? I have all this data and all these documents. How do I do how do I get started? And my team leader looked at me and said, well, it's not quite so easy to explain. And so I knew right there might be an issue. And so then what she suggested I do is actually go pull the most recent review from 3 of the most experienced, respected reviewers in the division and read them, and then that would tell me how to do a review. So I thought that's a good idea. And I went and I pulled a review from each of the 3 most respected reviewers in the division, and I laid them out and I just read them one after another. And when I got done with that exercise, I realized they're all completely different. Each review was completely different. And I have this slide just to show this most extreme example of what that difference can look like. And I purposely looked for example of this level of extremeness. But essentially, reviewers were doing whatever they felt like they thought was reasonable. And that's what I did for the first 4 or 5 years of my career at FDA. Is I just performed my review in a way that I thought seemed reasonable, and it looked very different than every other reviewer's review. So obviously this is not good for consistency. So what happened between then and now? So in 2004 and 2005, standards were developed and established for exactly how a reviewer or what a reviewer should be doing. And there are guidances to reviewers on how to do a proper safety review, as you can see here. And so for the first time, reviewers were being instructed exactly what it was they were supposed to be reviewing. And so from that point on, reviews, when you look at them, they have followed the same structure and the same topics and the same outline, and so you started to get more and more consistency. But let's take a look at this safety review guidance a little bit more. So if we look at this slide, it shows you the sorts of assessments that reviewers are supposed to be doing as part of a safety review for their NDA or BLA. You see it's an awful lot, but it doesn't stop there. We have this slide. They're supposed to be doing this as well. But this is not it. So let's go to the third slide. So this is just the safety portion of it. It's a huge amount of work for the reviewers, and then they still have to do a lot of other work to assess the product. So with that amount of work, it's easy to see that with that kind of scope and size of work that reviewers are supposed to be doing, that variability is going to occur with regard to the approach and how they do it. And a lot of times that variability relates to the reviewer's skill level, their technical skill level. So we may have a reviewer who's been in practice for 20 years and has tremendous clinical insight and knowledge, but they're not necessarily the most savvy with data and analytic tools. And so the way they approach their assessments of each of these items in these documents is going to be very different than, say, a reviewer that's right out of training and is more facile with data and software and things like that. So that even though we have standards with regard to what is supposed to be reviewed, we still have a huge amount of variability with regard to how the review work is being done. So what's the solution to that particular challenge of inconsistent approach to doing a review? Well, the solution that we came up with was to create this Computational Science Center. And the Computational Science Center is designed to improve the review environment and make it easier for reviewers of all technical abilities to perform basic, common, standard, best practice type analyses. So in our effort to do that, we immediately realized that the most limiting factor was the data. When we received data from Pfizer, it looked very different than the data from GSK, which looked very different than Abbott or other companies. And because the data looked completely different, it was almost impossible to develop any automation or any tools that could be reused from sponsor to sponsor, because the data, not only was the data different, the definitions and the semantics of the data were very different. And so we realized very early that the only way we were going to be successful is to really push this idea of data standards, so that the data, the meaning, and the way they looked were the same from one sponsor to the next. So that allowed us to develop some reusable tools and analytic capabilities. And so although data standards were approved for submission in 2004, we really weren't receiving much of it when we started the CSC, the Computational Science Center. And over the last few years, we went from about 10% in 2009 to over 50% of applications now have standardized data. So let's take a look at just some of the components of the Computational Science Center effort to do this. And each one of these bullets represents a pretty significant activity that I could give an entire lecture on individually, each by itself. But essentially, there's a huge amount of work to do with regard to creating governance structure with regard to data standards, developing policy. It's not good enough to tell industry that we want standard data. We have to tell them with more specificity than that. And that requires the development of guidance documents that give them clarity about exactly what it is we mean when we ask for standard data. And then ultimately, we need to create a validation system that gives us control. So when the data hits our door, we can perform rapid assessment of the data and understand what its capabilities are, where its flaws are. And that's sort of the basis of this modern review. Turning towards the data standards and validation, so I mentioned that we have a governance structure. We have a data standards board in CEDAR that makes decisions and represents CEDAR's interests to data standards organizations and others outside the agency. We also worked very hard with Teresa Mullen to get an agreement in PDUFA 5 that would require standard data submission, and that's going to be phased in over time in accordance with guidance documents. So we're developing guidance documents to support the requirements spelled out in PDUFA 5. We also created this thing called the Data Fit program, which is that system, and I'm going to show you a glimpse of what that looks like, that takes clinical trial data and performs a rapid assessment. Typically, the reviewers will find data flaws months into the review because it's impossible to hunt through the data and find every little flaw at the beginning. And by that time, the review is maybe halfway over, and it's very disruptive to realize in month 4 that you can't really do a proper liver toxicity analysis. So we front load all that assessment in the first week, and that way it gives reviewers a chance to have a discussion with sponsors about resubmission of data and that sort of thing. And we also have a program called FERS that performs an assessment of sponsors' quality of data management and coding. We also programmed up a series of SAS macros that generate about 50 to 60 common standard analyses. And we also created this program called MADE, which does a series of really nice adverse event analyses looking at standardized measure queries and that sort of thing. So this is the cover sheet of the document that accompanies the standard analyses in J-Review. This is a Hy's Law analysis. that plots ALT against Billy to look for hepatotoxicity. And here you see that on the left-hand side you have the ability to look at the same plot for males versus females just by clicking on and off, or looking at different age ranges or different races, so that you have some ability to do that. But then also, you also have the ability to lasso a collection of subjects, see who they are very rapidly within like a second, and then go straight to patient profiles to understand what happened to each one of these subjects during the clinical trial. And this is the sort of thing that clinical reviewers really do all the time. They start with a big sort of overview picture, and then they want to understand what's happening to individual subjects so they can understand whether there are confounders or what were the circumstances that led to the particular events that happened to the subjects. This is just a brief table that shows you the general categories of the SAS macros. Each one of these has a series of analyses, and it's very accessible to reviewers because it's in a Excel format. And this is the MADE program. I think this is the last one that I'm going to show. Essentially what MADE does is it performs standardized measure queries. And if you're not familiar with what those are, you can find all sorts of information on the internet about standardized measure queries. But it's a very powerful signal detection tool for looking for potential safety signals or toxicities. And there have been several instances where reviewers have found a toxicity that even the sponsor was unaware of by running, because the reviewer ran one of these SMQs. So in conclusion, I hope I've sort of given you a brief overview to see how CEDAR is moving very rapidly towards this more modernized, integrated bioinformatics-based review environment. All those tools that I showed you don't require a whole lot of skill. We particularly designed them so that they require minimal skill. In many cases, you're just double-clicking that level of skill. So we're reducing the barrier to all reviewers to be able to do analyses that they themselves as a community have defined and decided are best practice. Of course, it all requires and starts with high-quality standardized data. We work with the reviewers, of course, to define best practices for analyses. And they're now actually getting access to these tools. So we spent 3 or 4 years developing them, and now they're available to reviewers, and they're actually using them. And I think all of this is improving the efficiency and the consistency with regard to how reviewers are doing their work. And we obviously have a long ways to go and a lot of work to do, but I think the early results are very promising and showing some good results and impact on the review process.